Hello. So we are going to do an ear swab cytology. I've already gotten my sample from the pet. So here's our two little ear swabs. One is cut in half to signify that it is our left ear, and this one will be all right. So as I'm preparing it, we don't want to necessarily rub it, but just lightly roll the swab to get as much sample as we can. And then do the same for the other side. Okay. Then always label your slides on which side is which. So in this case, left is on the top and right is on the bottom. And we'll also have the patient's name as well and their signalement. So once we have our slide prepared, we'll put it on the microscope and get ourselves focused on the lowest focus, which is R10, and then slowly move up until you eventually get to oil. Just want to make sure you have it focused on all fields. And we'll have it focus, 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 focus. There we go. And move up. And then we'll go on oil, but before we go on oil, we put a little tiny drop of immersion oil. If you don't, practice members get very upset. And then we have to replace the lens, which is not very costly. And there we go. Okay. And then here we're going to do our skin scrape. I have a scalpel and I have lubricated it up with oil immersion. I'm going to lightly scrape the skin. Going to lacerate it slightly, that way we get some sample onto the scalpel blade. Once the skin is collected, we'll go ahead and place it on our microscope slide. We'll view it for microscopic evaluation.
Can this switch around? Hello? Hello?
Question mark?
Hello? It was Paula that did it.
Hello.
And it is got some blood.
Tis me.
Can't, the fucking switch around button disappeared.
There is our skin impression stain slide. There is a squamous cell right in the middle. It's a little bit clear, so it's hard to see. And then the rest is just gunk. Right here, I'm using a Q-tip, and I'm going to put sterile saline on it. I'm also using a vaginal speculum to actually insert into the vagina. That way I have taken allowing a clear passage for me to be able to take my sample.
With a
Here I'm struggling a bit to
an ear
handle my
Q-tip,
speculum.
and I put some sterile saline on it. That way it's flushed
into the
That way I'm able
vagina
to collect
and
the sample.
we get our sample.
And there we have it. Collected the sample.
Now we're going to talk about vaginal cytology. We collected our sample just from the vulva using 2 cotton-tipped applicators. The patient was anesthetized and under anesthesia, so we didn't have to worry about any of her movement and her being uncomfortable. So you'll take one of the cotton-tipped applicators and apply the sample like so. Similar to how you would apply an ear swab cytology, just slightly roll and not smush it all together. I like to do 3 different lines for 3 different viewpoints just to make sure we don't miss anything. Once that's done, label your slide with your patient's name and specimen of what you're viewing. So our patient, and then vaginal cytology. Once we have that labeled, we'll go ahead and stain it. So same principle as we did with our ear swab cytology and our skin impressions. We'll do 10 seconds of the blue. And we'll do 15 seconds of our red fixative. Make sure to blot any excess stain just to not continue.